I'm Dr. Hugh from Biosea Health. One of the things we talk about is that heart disease is the silent killer. Hypertension, you don't know you've got it until you've actually go along to the doctor and discover that you have a heart attack or some other sort of stuff. When we're looking at seaweed as a feature of providing reduction in hypertension, confirmed when I went to visit with Professor Lindsay Brown out of University of Southern Queensland. Surprisingly in those studies is that rats who ate seaweed over a 6 to 12 week period reduced their blood pressure by about 10 millimetres. Reducing your blood pressure by about 10 millimetres means that your life expectancy goes up years. This is from years and years of data from diabetes and blood pressure, because when you have blood pressure high, your life expectancy is lower. They fed these rats and some of them have been supersized, and so they had metabolic syndrome, and literally within 6 weeks those rats actually were back down to normal blood pressure. The poor rats at the end of the trial were then sectioned and they looked at this at the heart condition, and what was surprised them was that these rats were back to what they were normally without metabolic syndrome. Now, this is peer-reviewed published papers. It's worthwhile to have a look at it. If you've got high blood pressure, you want an easy way to reduce that blood pressure, that hypertension, whether you're taking blood pressure tablets or not, then just take 5 grams of seaweed a day. It takes about 6 weeks of eating seaweed until your blood pressure actually reduces. But at 6 weeks, the patients actually were statistically lower than those that took placebos. By the end of 12 weeks, the reduction in blood pressure was at least 10 to 12 millimetres of mercury. It didn't make an effect if you didn't have high blood pressure to start with. You didn't wind up where your blood pressure was reduced even more. So there's no concern about that. We all know that hypertension or increased blood pressure is the silent killer. When we were looking at using seaweed as a dietary supplement, one of the things that astonished me was that there was clinical work out there from nearly 10 years ago when Dr. Jane Tees took people who had hypertension. In fact, they actually had metabolic syndrome, so they had hypertension, increased weight, increase in cholesterol, and challenged in terms of sugar. Within 6 weeks, there was a significant reduction in their hypertension and their blood pressure, and by 12 weeks they were between 10 and 13 millimetres lower in their blood pressure. It seemed to me that this was a really good reason to introduce Pacific Seamoss, really easy to take,